Hello, everyone. This is Abdul Chaudhary from Starling Diagnostics. I have with me Dr. Nawaz Hussain, also the medical director of Starling Diagnostics. Today, we're going to talk about liver. What are the functions of liver? What is fatty liver, or what are the diseases around it? So, Dr. Nawaz, please.
Hi, Don. So, to understand fatty liver, first we have to understand the function of liver. So, liver is one of the largest solid organ in our body. It maintains a certain level of healthy blood sugar in your blood. It also metabolizes fat. It takes away the toxins from your blood. And there's multiple other functions of liver, like the medication you take in. It metabolizes the medication as well. And fatty liver is when you have fat around the liver, okay? And there are different stages, fat around the liver, and then it causes some liver injury after the fat, and then it can lead to liver cirrhosis when you have the liver becomes all scarred up, and then that can lead to liver cancer also.
So, can you explain a little bit more about fatty liver? Who's prone to fatty liver? Who gets fatty liver?
So fatty liver, you could get with alcohol intake, so that's called alcoholic fatty liver disease. And then there's another section where you could get, people who don't drink alcohol, they get fatty liver, okay? So those are the people with metabolic syndrome. So metabolic syndrome means you have a combination of problems, which is high blood pressure, high cholesterol, your waist size is high.
About 40.
Yeah, about 40 for men. And then people with diabetes, they can get fatty liver. People who are obese, they can get fatty liver. Fatty liver can lead to insulin resistance, causing diabetes. And then diabetes can also lead to fatty liver. So it's like a cycle.
So fatty liver, would you say fatty liver is directly related to obesity?
Yeah, so, well, not directly, because even people who are not obese can also get fatty liver as well. So fatty liver right now is a very big concern in our health industry, because since 2004, the number of fatty liver diagnosis has tripled. Okay, and in a few years, the cost of fatty liver.
Why do you think it tripled? Is it
because of our lifestyle? The way we live, the type of food we eat. But there's increased number of obesity. Obesity is the number one risk factor for fatty liver.
Right. So what are the symptoms? Like, how would one person would know? I understand, alcohol is one thing. So first of all, just because you drink alcohol doesn't mean you're going to develop fatty liver if you drink in moderation.
So mostly people who binge drink, meaning in one sitting you drink a lot.
Right.
Okay, they're at most risk. But how do you develop it is because of mostly diet.
Right. So what are the symptoms of fatty liver?
Okay, so the symptoms, you could feel fatigue, tired all the time, low energy at the beginning stage, and then you could have some abdominal pain, because the liver gets big, and then it causes pain in the right side here. And then when you have advanced liver disease, that can cause more problem. Like you could start retaining fluid, your abdomen gets bigger filled with fluid. You're gonna start retaining water in the legs. You could become confused, brain's not functioning well, and then you could start vomiting blood. So those are
that's the serious thing. So how do you diagnose it? Like if someone comes in the annual visit for you, would you is it one of the components that would you diagnose it, or
not during annual health visit, but when you do blood tests, sometimes if there's liver injury, then you could have some elevation in liver enzymes. Not all fatty liver have elevation in liver enzymes, but then they could have abdominal pain. Then
then you do ultrasound,
and then you could do ultrasound to see if there's fat around the liver. And then if there's fat, if you want to know how much fibrosis in the liver, then you have to do a fibroscan. And, then you have to monitor closely if there's fibrosis, because that can lead to liver cirrhosis and cancer.
Right. So can you tell a little bit about liver cirrhosis, cancer, and...
Yeah, so liver cirrhosis is irreversible. Until that point, everything is reversible. So meaning if you have some fat around the liver, it's still reversible. If you change your lifestyle, then, it might go back to normal. But once it's liver cirrhosis, then you cannot go back to normal, okay? And then liver cirrhosis, meaning the liver is scarred up. It's not functioning anymore.
Right.
And then that can lead to cancer once you have liver cirrhosis.
So what are the suggestions you have for our audience in order to not develop fatty liver? So lifestyle changes, food.
So lifestyle changes definitely is the number one. So studies have shown that obesity is almost directly related to it. So if you do exercise, resistance training exercise, right? So even if you don't lose weight, exercise by itself can help with with fatty liver. The recommendation is to lose about 3 to 5% of fat, total fat, total body weight, to see some changes. But generally 10% is what's recommended to lose weight.
Let's talk about, you talk about total body weight, BMI. You're talking about, right? So if you have over 30, let's say, that's obesity. So we have risk of.
Right. So recommendation is from 7 to 10% of total body weight that you got to lose to see some changes in the liver. If there's some injuries to the liver, then you have to do at least 10% of weight loss to see some change. There are other treatment options, like for example, coffee. Research have shown that if you drink coffee, like about 3 cups of coffee a day, black coffee, then that helps with liver fatty liver. It prevents further progression. There's also other studies have shown vitamin E.
Not to say don't drink coffee after 5 p.m.
Yeah. So that's what we talked about that before. But for other causes. But then there's also vitamin E and then vitamin D. These are shown to have some improvements in liver as well. The most effective is exercise and Mediterranean diet. So Mediterranean diet is where it consists of like legumes, nuts, like good fats, right? Unsaturated fats, which are good for us, right? So like using olive oil for example, as if you replace canola and vegetable oil for olive oil, so that's better. Increasing nuts in your diet, vegetables, fruits, lean protein. So these are all part of the Mediterranean diet. It has shown to have some benefits.
Okay. Any last words for our audience?
No. So fatty liver is very, right now is one of the most concerning diseases. So we have to take it very seriously because it prevents further progression once you detect it early. But once you're at cirrhotic level, then you could get cancer. And so they say about 2/3 of diabetic patients will eventually develop fatty liver and fibrosis also. So that's how serious it is.
All right. Thank you, Nawaz. And again, until next week, we'll talk about it. And if you have any questions, please comment on it, or you can give us a call. Thank you.